Today I am going to present on the topic kerosene poisoning. Okay, now let us talk about hydrocarbon first. Okay, hydrocarbon is divided into two main part. They are allopathic, allopathic, and aromatic. Aromatic and mixed compound. So there are three hydrocarbon. So they are allopathic, aromatic, and mixed compounds. In allopathics we have kerosene. And in aromatic we have benzene. Benzene. And in halogenated we have also halogenated. In halogenated we have carbon tetrachloride. And chloride and mixed compound. And aromatic and halogenated compound have predominant effect on central nervous system. So aromatic and halogenated compound has direct role on CNS system, whereas allopathic hydrocarbon has direct role on pulmonary symptoms. It directly act on pulmonary lungs. So there is risk of expiration. The most important manifestation of hydrocarbon toxicity is aspiration pneumonitis. Why there is expiration pneumonia, pneumonitis? Because there is inactivation of type 2 pneumocytes. Due to inactivation of type 2 cells that is present in the pulmonary, that is present in the lungs, that causes pulmonary pneumonitis. That is the things we have to know. And one of the most important thing is that every expiration, the propensity of hydrocarbon, propensity and of hydrocarbon to cause expiration pneumonitis is inversely proportional to so risk of expiration is inversely related to viscosity and directly related to volatility. So we all know kerosene is most volatile. So what means it is directly proportional means there is most volatile means risk of expiration is more chance. Now let us talk about clinical and laboratory manifestation. So mainly kerosene affect lungs, respiratory system. So symptoms develop early within 6 hours, due to aspiration. And also there is vomiting. So when there is ingestion, there is vomiting as well. So what happens? So due to ingestion and the following vomiting, there is higher risk of expiration. Symptoms may vary from mild cough and respiratory distress to acute respiratory distress syndrome and respiratory failure. So the symptoms vary from people to people. It varies from mild cough to respiratory distress like to ARDS and respiratory failure. This is the things. The chest radiograph may be normal initially or show infiltrate pleural effusion, ARDS and nematocele later. So normally the kerosenes have this feature. If there is involvement of CNS, CVS, then there are other features as well. If there is CVS, there is restlessness, drowsiness, seizures and coma due to hypoxia and acidosis. If there is involvement of CVS, then there is this arrhythmia seen with aromatic hydrocarbon abuse. Fever and leukocytosis are common and do not necessarily imply bacterial superinfection. Recovery usually takes 3 to 8 days but may be prolonged due to suprahepatic pneumonia. Male sex and malnutrition may prolong the length of stay in this case. Now let us talk about treatment, how we treat the cases. So treatment of mainly hydrocarbon or kerosene. So if there is evacuation of if there is these things hydrocarbon going on, or kerosene poisoning is going on, so evacuation of stomach by gastric lavage or induction of emesis is not recommended because of lack of risk of aspiration. Cautious evacuation of gastric contents is recommended in patients with poisoning by product contaminated by pesticide, heavy metal or other toxin. All patients with history of hydrocarbon ingestions will be observed for at least 6 hours irrespective of the clinical status. Now we'll approach the case. How will the case if the person has hydrocarbon ingestion? So what happens? The case is asymptomatic or might be symptomatic. What are the symptoms? Mainly the symptom will be respiratory like wheezing, altered sensorium and tachypnea. So these are the symptoms. So if there is asymptomatic, then what happens? We will be looking chest x-ray. So if nothing, then we'll discharge him after emergency after 6 hours. Okay, if asymptomatic. But if the patient has abnormal chest x-ray, then we have to admit and observe discharge if symptomatic and follow up in inside. Okay, chest x-ray normal, abnormal. Okay, so then we have to admit the child. Okay, and the asymptomatic in this case, if the patient is symptomatic like wheezing, altered sensorium and tachypnea, we have to admit first. We have to give oxygen, IV fluid. Okay, and we have to give beta agonist. Okay, and monitor respiratory and neurological status. We should not give no steroids or prophylactic antibiotics. Okay, so we should not do gastric lavage or induction of emesis. Okay, with this I have completed my presentation on hydrocarbon poisoning or kerosene poisoning. If I am anything is wrong in between, we can discuss and find the solution. Thank you.